News Canada. Information for life. Like thousands of Canadians, Lucia Reynolds of Ottawa is living with multiple sclerosis.
I was diagnosed with MS 3 years ago. At that time, I was experiencing symptoms of numbness on the left side of my face, loss of concentration and focus, fatigue, loss of balance, coordination. So when the doctor told me that I had MS, and I was shocked, I was devastated and frightened for what my future would be like.
Recently, Health Canada has approved a new indication for the drug beta-seron, making it the only high-dose, high-frequency therapy approved for treatment of the earliest stages of MS in Canada. Dr. Mark Friedman is a professor of neurology at the University of Ottawa and a primary investigator of the BENEFIT clinical trial for beta-seron.
We've learned that in MS, irreversible damage occurs early. You want to be able to identify a patient, therefore, who's at high risk of going on to develop MS even after the first time they present. In the BENEFIT study, that's the patient group we focused on. We were looking at the placebo group and saw that 85% of those patients indeed went on to develop MS, but by giving them beta-seron, we prevented that risk by 50%.
Until now, there has been no safe, high-dose, high-frequency treatment available to patients who had experienced a single clinical episode suggestive of MS to delay or prevent the progression of the disease.
Health Canada's approval of beta-seron now gives our patients another option for a superior, high-frequency, high-dose medication to delay further development of irreversible damage and hopefully stave off progression. Knowing that early disease is irreversible, it's so important for patients to recognize early symptoms of MS and seek out proper neurological consultation so a diagnosis can be made, at least that they're at high risk of developing the disease, and then be given the treatment options, one of which would be beta-seron. The makers of beta-seron have a 24-hour support network, and in that network are professionals who understand MS, can explain to patients about their disease, can discuss the medications and its side effects, and even help with reimbursement.
When I had the opportunity to participate in the BENEFIT study, it gave me a sense of hope, and it was like a light at the end of the tunnel, because the doctors had told me there's no cure for this and there's no treatment for someone who is first diagnosed with the first attack of MS. For people who have MS or have been diagnosed with MS, or those who aren't even on any kind of treatment, I strongly recommend that they go see their doctor and explore the treatments that are out there, because being on the beta-seron has given me control of my life.
For more information about multiple sclerosis and treatment options, speak with your doctor. Free 24-hour information and support is also available by calling MS Pathways at 1-800-977-2770 or online at mspathways.ca. Sherry Dematarco reporting. News Canada. Information for life.